What I think connects us all is that here in Bath, here in our district, we have the Fashion Museum, and that's the one thing that unites us all. And it is, it's a special thing, and it's something that we would be very keen to connect more with you, because we'd like to ask for your help, for the help of your agencies, as we prepare our displays for summer 2022. So I'm here asking for help because our exhibition at the Fashion Museum in summer 2022 is going to be called You Choose. We have 10 display cases, and we would like to find 10 individuals, or preferably groups of people, 10 community groups of people, to help us to decide what's going to go on in display. And really, I guess that frames itself around two crucial questions, which I'm going to share with you today. And then I'm going to share with what our next steps might be. And the two crucial questions are, question number one, fashion. What does that mean to you? And the second question, following up a little bit more practically, is what do you want to see at the Fashion Museum? So the two questions are fashion, what does that word mean to you? And the second question is, what would you like to see at the Fashion Museum? I don't know how I'm doing, Mark, on 2 minutes, but I think I must be practically there. What I would say to you is, if people could perhaps email me to let me know whether or not they would be interested in taking part. And Mark, perhaps you could share my email address. I too am a colleague of Mark. I work for the council. Just let me know whether or not you might be interested, and then we will get in touch again. We will progress this a little bit more in the autumn. Does that all make sense?
That's fantastic, Rosemary. I think yeah, what Alison's going to do is she's going to make sure that the details go into the chat now, and I think you've got your core message across there, and I think people then can make sure that that they get in touch with you to give you their reactions. Okay.
Fantastic. Fantastic. Well, shall I go now then and let somebody else have the floor? Okay.
Yeah, I mean, if anyone has any immediate questions that they wanted to raise for Rosemary immediately now, please show hands and we'll bring you in.
I will wait for the emails to roll in. Anyway,
Okay.
Lovely to see you all. I'd love to know who you all are. I'd love to talk to you all, but thank you so much for inviting me to your meeting, and look forward to maybe catching up with some of you later on. Okay, thanks so much.
Thank
Bye.
you. Bye. Bye. Hi there. Okay, that's great. Thanks to Rosemary for that. Can I bring in Louise Lees now from Baines Public Health, please?
Hi everyone. Okay, 2 minutes. So I'm here from the.
It can be a little bit longer if you, Louise. I know you had quite a lot to say, so that's fine.
So thank you, Mark. My name's Louise Lees. I'm a health improvement officer in the public health team here at Baines Council, and I wanted to talk to you today about our new mobile rapid lateral flow testing van that's going to be travelling around Bath and North East Somerset for 7 weeks from Monday the 9th of August. I will do a written briefing and we'll get that out to you all within the next few days, so don't worry too much about the detail. But I also have some questions that I'm hoping to ask you, and those questions are, I'm interested to know how the people that you're working with currently are finding accessing community testing, and also as community testing kind of moves forward to a new phase, we are targeting the disproportionately impacted and underrepresented groups far more now. So we really want to find out how any ideas you have for how you can help us reach people that you may be working with. And I know that we'll be putting out social media posts and email comms, which hopefully you could share amongst your networks. But particularly if there's any local community events, local community events that we could link to during July and August, that would be great too. And I'm just going to pop those questions in the chat. So yeah, very, very quickly then. Oh, I've got a picture of the van as well. I'll pop that in the chat. The idea really is to increase confidence and an uptake of rapid lateral flow tests, particularly to help people manage their own personal risk as we move forward through the pandemic. And we know that rates are rising, and there is always the fear of new variants emerging. Oh, sorry, the van didn't go in the chat. You'll have to wait for the email. So it's really important that people are supported to manage their personal risk. I mean, that's more or less it, Mark. I mean, is there anything else? Oh, I've got a very quick update with the vaccination bus as well. So the van is I'll just really quickly say that the van is a long wheel-based van, and we've got a team from Richmond Events Management. So we've got 3 outreach staff plus the van staff doing outreach. We've got a whole set of venues. They'll be published weekly on our website. So I'll put the link to that in the chat as well. We also have our static sites in Keynsham and Midsummer Norton that will be closing week ending the 6th of August. So the mobile van will be replacing those 2 static sites, but the site in Burton Street in Bath is still going to be in place for certainly until the end of September at least. And of course, very much wanting to encourage people to access tests online and also by phone, and also through their local pharmacies and one-stop shops as well. So there's various ways in which people can access tests, and part of the outreach is really about supporting people to find out where they can access tests, as well as providing assisted testing as well, supervised testing. So certainly with our community trusted organisations project, we've had some feedback that people are quite nervous about doing a rapid test. So having somebody kind of show them how to do it really, can really help with confidence. Mark, am I all right for another 30 seconds and I'll move on to vaccination?
Yeah, I just had one quick question, if you do. With anything like this, it's always really useful to know where people can find out what the schedule will be for where the van's going to be, because I know that we had some feedback about the vaccination bus not always kind of bringing the information to people quickly enough so that they could partake in it. So is there going to be somewhere specific that people are going to be able to find that information out?
Sure, thank you. So yeah, it's going to be on our website, which and it'll be published on a weekly basis for the next week. But we'll also be emailing all of you so that you know that in advance. And I'm just putting the link to the website here. There we go. So if you keep checking that website, it'll be on there.
Fantastic. Was there anything else that you wanted to add at all, Louise?
Just really quickly on the vaccination bus, if that's okay. So it's operating next week and the week of the 16th of August. Then the bus will come off the road and they're going to have a bit of a rethink. And I've got the dates actually of the vaccination bus here, so I'll pop those in the chat as well. And I'll pop in my email address. So anything else, do get in touch.
Fantastic. Any questions for Louise at all? What are we doing on the screen there?
Suggestion from Gwen about putting it on Facebook as well.
Yeah, I think yeah, Gwen's just sort of mentioned in the chat that maybe adding it to Facebook would be another way to get a different audience possibly to come along.
Yeah, if I may, I'm Richard Burgess, station manager at Summer Valley FM. We manage the Baines, or I manage the Baines public service announcements on the radio, which goes across the whole of the authority. And I see Bath, I think Curo on here as well, and Bath College. I also manage messaging for them as well. So Louise, I spoke to Matt Rees this morning, who I think does the communication for COVID, and I plan to interview Becky when the bus comes down. I do think it's important to publicise it because I'm in North East Somerset rather than Bath, and I'm not aware that many people are aware that the fixed test sites are actually going to close down. So if I can help, or I will help publicise the mobile testing unit, because it's important for this area.
Thank you. And yeah, we are. So I know Matt has got quite a lot of comms planned, and we're really interested to work with you. I'm not sure if he's on the call. Do you guys want to have a quick look at the van rather? I could share my screen.
Yeah, please, that'd be great.
All right. Oh, how do I share my screen? Oh, this is where it all falls. It all goes to pot, isn't it? Oh, share screen. There we go. Yeah, can you see the van?
Yes, yeah.
So and they're all going to have matching t-shirts as well. So it's not the Asda delivery van, okay?
Yeah, fantastic. No, it's can't miss it though, can you? It's nice and valid. Excellent.
Great. Thanks for your time today.
Excuse me, Louise. Did you say that they'll be wearing t-shirts? Because I did see a van locally over in the South Gloss area that people were obviously sat outside of waiting for people to come, but it didn't look legit, if you know what I mean. So I think from the public's point of view, it's also a case of being really, really clear that that is a government provision.
Yeah, thanks, Cathryn. And actually it is the same company, and that's why we have gone for these branded t-shirts in Baines, because of concerns that people don't know who they are or what they're there for. So, but we didn't want to, go for all the high vis, too official. We want to be friendly and approachable.
Yeah, I just think it probably could have done with some sort of government trademarking that was linked, obvious on it. The one that was in South Gloss was pink.
So this one's green. It has got the NHS and Baines Council branding on.
Excellent. Okay, that's great. Thank you, Louise. That's really, really useful update there. Could we then move on to Louise Clapton next, please, for your update?
Hi. Yes, I'm Louise Clapton, Community Development Officer at Dorothy House Hospice, and I'll be very quick because I'm here mainly to listen to other people today. Dorothy House looks after patients that have been diagnosed with a life-limiting illness. We look after their families and their carers as well in Baines, East Mendip and North and West Wiltshire. And the most important thing I want to make you aware of today is that patients can self-refer. They don't need to be referred by a healthcare professional, which is something that changed during the pandemic. So if you have any clients that you think might benefit from self-referral, they just need to contact our clinical coordination centre, and I will let Alison have all those details. Just to say we're as well still undergoing our service review, which will see our teams further embedded into communities and actually will be physically based out in communities. So we're through the design stage now and looking at operational plans. And part of that work will bring groups that will be accessible to the wider community, not just those that have been associated with Dorothy House. So we already have some of these groups in other areas. So we have bereavement help points. We've got one in Corke, one in Malmesbury and one in Shepton Mallet, which have proved to be meeting a need. So they're available to anybody that's been bereaved for whatever reason. And also a Coffee Connection, which is more of a social group, and that is available to anybody that has been affected by a life-limiting illness. They're not open yet, but they're part of the plan. Thank you.
Hello, so I run the curriculum for the Adult Community Learning Centre at Bath College. So for anyone who doesn't know, we run courses for adults who are over the age of 19, who are not in work or earning less than the minimum wage in a full-time job. So we can support them through courses such as art and horticulture and animal care, right up through to IT skills, maths and English GCSEs for anyone who doesn't already have them. All of our courses are free, and we can provide childcare and travel costs for those who are experiencing any kind of difficulty in that respect. If anyone wants more information on that, feel free to give me a shout and I can add you to my email list, and I can post you out one of our brochures with all our courses, which run from this September right up until next summer and are literally going to be hot off the press. So yeah, so let me know if you want one of those posted out to you. The reason one of the reasons I want to speak to you today is about a course that we run over the summer, which we call Advantage. We run it in conjunction with the Bath Rugby Foundation. It's a 4-week course for young adults aged between 19 and 25. And the aim is to get them into a position where they're almost ready to go back into employability or into training by boosting their confidence skills, employability skills, and we work on their resilience, teamwork and community work. So we do a lot of fun stuff like mountain biking, trampolining, some of the things that these young people probably have never had the opportunity to have. A lot of them are in a position where they don't have a support network at home, they are living in supported housing, and they just need someone to actually care about them, basically. So this course, again, it's totally free. We can fund travel, we can fund childcare, we feed them the whole time, which 20-year-old men can actually amount to more than the actual course cost sometimes. And the whole thing is just amazing. And it's our 3rd year, so we've had some really good results getting these young people into employment, and just supporting them in a way that is a lot less intense than coming into a full-on college environment. So the course is running for 4 weeks, starting on the 3rd of August. It's 3-4 days a week, just from 10 till 2:30. And like I say, it's for anyone who's 19 to 25, are not currently in work and live in Baines, in Bristol or South Gloss. So those are our eligibility criteria. That's all I had to say. But yeah, so it's a really, really good opportunity. So I'll put my email address into the comments. But if anyone wants to contact me either about referring young people that they know or they're supporting into that, or just to get onto our email marketing list so I can send you out an update of all our courses, which, like I say, run through the year, just let me know. Thank you.
Thank you, Kelly. That's really interesting. Thank you very much. Can I ask for Denise Perrin to speak next, please?
Yeah, sorry, finding me clicking on me the right things. Hi everybody, my name's Denise Perrin. I am project manager for the Village Agents, covering virtually all the rural areas of Bath and North East Somerset. We offer a one-to-one service for people who would like to connect with information, advice and support to help them live independently, but also we run alongside that some wellbeing activities, and we're very much in that health prevention area of work at the moment, particularly last year, and it continues. So I'm just in the process of put my contact details into the chat, and we do accept professional referrals, but also I've got a few public events. We ran our first one last Tuesday. I've got a few public events coming up over the next few months, and I'd like to be able to showcase some of your organisations relevant to the areas that we're going to be in. So the next one's in Timsbury, and I'm in the process of planning one in Peasdown for November. Thank you.
Thank you, Denise. That's great. Thank you very much. I'm just going to take names off my list now. As I say, if anyone does need to go, I think Andrea is Andrea Wyithe from Curo.
Hi. Thank you. Yes, I'm from Curo Independent Living Service. We support people in the Baines area and North Somerset and some parts of Bristol. For people in the Baines area, we do have funding. So if anyone has savings of under 23,250 and from the age of 40 and above, we can provide a minimum of 6 months free service. For those who don't fall into that category, there is a funding service. We support people in their own homes to live independently, or if they want to move, we help with home search. We make sure people are in a high banding, and we help with the whole moving process just to relieve that stress. We help people with day-to-day struggles. If they're struggling with shopping, we can either collect shopping for them or take them shopping. We take people to appointments. We help with paperwork and benefits. We advocate for people to make sure they're treated fairly. You know, people who feel like they're being slipped through the net or not being heard, you know, we make sure their voice is heard. And we signpost, you know, we can refer to OTs, physios, things like that. We can take people out for walks, out for a coffee or to events, you know, because after being isolated for so long, a lot of people have lost confidence, so we can help build their confidence up in those areas. And people can self-refer or be referred. It's either way. If they're referred to us, we go along and have a chat and see if our service is suitable and if they'd like to go ahead with it and discuss their support needs and wants. If anyone's got any questions, or if you want to make a referral, please do. We presently have funding available. We have capacity, so if people do have savings of under 23,250 and are 40 or over, we can support for free, and we've got space. Thank you.
That's lovely. Thank you, Andrea. Are you happy for us to share your details if people want to contact you?
Absolutely, yes, please.
Fantastic. Thank you very much.
Thank
Lovely.
you.
Next name I've got is Kate Young. Is Kate with us?
Mark, Kate is on leave this week, so I'm stepping in place of her.
Hi there. All right, Tom. Okay, would you like to go ahead?
I will, yes. I'll tell you what I'll do for a laugh. I'll time myself to see if I can keep it under 2 minutes.
No. Okay,
that'll be fun. Nice to see everybody. I sort of missed the physical meetings really when we can all get together. I'm from the Carer Centre, so we're supporting unpaid carers of all ages from 5 and upwards. So we've got a really good young carer service. We've been really busy during the lockdown, contacting everybody on our books, keeping in contact with them, supporting them, and a lot of them have been forgotten by lots of other organisations. Not in a bad way, but everyone's really busy, so it's been really good to support them. The sorts of things that we've set up are online cafes, so we've got 14 cafes that run every month, which is brilliant. We're now doing in-person cafes as well, which is great, across Baines. We've got one in Midsummer Norton, one in Bath and one in Keynsham, which is brilliant. Nice to get those up and going. And we're having events at our centre as well, because we've got a marquee outside, so we're continuing with the same COVID restrictions, but we are putting events and breaks on. We've got a brilliant support line, and I'd say to a lot of professionals as well, I work quite closely with the care coordinators now at the GP surgeries, which is a great piece of work, which is proving to be really important for carers, I think, who are on GP registers and possibly not aware of the support that we provide. So we're doing a brilliant piece of work around that. Siobhan Jones is here from Hope House Surgery. She'll tell you all about her work later, no doubt. And our support line is brilliant because it's for professionals as well. So I always say to professionals, if you've got any queries that you've got someone who you're supporting, you're not quite sure what to do, where to go, where to get the information from, then you can just ask our support team, and you can email them or you can phone them, and it saves you having to do the work. You don't even have to Google anything, you can get us to do it for you. So I think that's quite a handy resource, and we know so much about so much what is out there in the community for people. So please do tap our brains for that. That's 2 minutes, so that's not bad. Any questions, please do email me, and I'll put a little link in the chat. So if you've got any carers that you want to refer to as support, then please do just ping it online to us and we'll contact them. Thanks very much.
Thank you, Tom. That was great. Thank you very much. Is Ruth Atkins with us at all? Would Ruth like to go next?
Yes, I am here. Sorry.
Hello, Ruth.
Hi, everyone. I just wanted to update at the moment is we produce in the Clinical Commissioning Group a fortnightly bulletin. It has engagement updates, some updates on COVID and things, and meetings we've got coming up in the Clinical Commissioning Group. If you'd like to be on the distribution list, if you're happy to, pop your email in the chat box and I can add your details to it, and you can look at it, and if you then decide, actually I've seen it and I don't want it, just email us back and we can remove you off the list. And also we have another newsletter. Some of you may have heard about the integrated care system across Bath, North East, Somerset, Swindon and Wiltshire, and they have a newsletter called The Triangle, which I think is bi-monthly. So if you're interested in that as well, we can add your names to the distribution list for that. And they're the main things for me at the moment. Thank you.
Thank you, Ruth. Can I ask Laura Nicholls, please, to speak next?
Hiya, thanks for having me here today. Yeah, I'm Laura. I'm the Community Engagement Officer for the City of Bath World Heritage Centre and also the Roman Baths. And I've got two things to share with you really today. The first one relates to my background. So as you might have heard, we're opening the new City of Bath World Heritage Centre this autumn. we're currently recruiting for volunteers, but I'm also interested if you felt that you had a service user that may benefit from assisted or adapted volunteering. So perhaps if you felt that they might not be able to do a 3-hour shift, or you think there's some changes we can make to allow them to volunteer, I'd be really happy to have a conversation with you to look at how we could include your service users, really. So that's the first thing. So feel free to have a talk and we can talk about what we could do or develop. The second thing, with my other hat on, I'm community engagement officer, and I've been over the past lockdowns that we've had, I've been producing sessions for community groups online. So whereas in the olden days we'd have people in person, we've been connecting online and been running some make and learn sessions, learning about history, Romans, and having a good old chat as well. So we're looking at continuing to run those, but also later in the year in the new Claw Learning Centre, we're looking at reintroducing in-person sessions as well. And we can be quite flexible. So if you think that your group of service users would benefit from some sessions where people can get together, learn a bit about history, but have some sort of art and craft activities as well, we can talk to you to discuss quite which direction you'd like to go in. But yeah, feel free to reach out and we can have a conversation, even perhaps a cup of tea, whether it's virtually or in person, and then yeah, see how our ideas can develop, really.
Thank you. That's really helpful. Thank you very much. Can I ask Sandy Merrell, are you okay to speak next, please?
Hello, everyone. Thank you for allowing me to join you this morning. So I'm Sandy and I'm from Core Ventures. This is sort of a new format for me and a new role as well. So again, I'd like to thank you for sort of welcoming me. Found that hard to say this morning. So Core Ventures offer high quality business support and have been doing so now for 10 years. And we've helped hundreds of small businesses to start up or grow over that time. And it's done through a series of webinars and one-to-one meetings. Obviously, in the past, that's been done in person. Everything's been done online recently, but we're hoping to get back to face-to-face workshops, etc. soon. I'd be interested to have anyone's ideas on when people think, you know, it would be a good time to go back to face-to-face meetings. And, you know, we've been asking people during our webinars, and generally people seem to quite like the convenience of being online, not having to travel to a venue to attend something. So the sort of timing of when it would be a good idea to go back face-to-face is something I'd be interested that if anyone's had any experience of that. What we provide is free through funding through Baines and South Gloucestershire councils. So we can offer really expertise support to anyone who wants to start up in business. And if anyone would be interested in us doing a presentation to any of their clients, just to sort of explore becoming self-employed as a viable option, then that's something that we are happy to arrange for you, either online or in person if appropriate. So I'm relatively new to the company. I've worked for Core Ventures since January. My previous background was running my own businesses, and also I've spent 10 years as a college lecturer teaching and supporting 16 to 18-year-olds. And one of my sort of intentions with my new role, if you like, is to free up some time for Sue Marchant, our managing director, and also help her to just form some relationships and partnerships within the community. So the sort of ethos of Core Ventures is very much to be part of a local community and help support local businesses. And that's something where we would like to engage with more of like-minded people and see where we can perhaps offer some support. So I have no idea how long that was. If there's any questions or if anybody wants to know any more about what we do, as I say, it's a free service. then I'll pop my details in the chat. So any questions, just please let me know. Thank you very much. It's lovely to meet you all.
Thank you, Sandy. That's really helpful. Thank you. Can move on to Sarah Oughton next, please.
Hi everyone, afternoon. I'm Sarah Oughton from Swan Transport, and our volunteers at the moment have been really busy. We're still involved with the vaccination programme, and also because the hospitals have really opened up now, we're doing quite a lot of hospital trips. Unfortunately, a lot of our drivers are on holiday at the moment because they're so exhausted because they've mostly worked throughout, and so we have got a bit of difficulty in terms of covering everything, but I'm hoping in a couple of weeks we'll be back to normal capacity. We've taken on a lot of new drivers. If anyone knows of anyone who could drive for us, we'd be really grateful. We've had a lot of success with new people coming, but the problem we have found is that we haven't got enough drivers who want to do a regular journey. They all want to do an ad hoc journey. And we do get a lot of ad hoc requests, but actually we need those regular journeys for people to be taken to places like the Peggy Dodd Centre and Forget Me Not, to all the different support groups that Mind run. So it's a crisis waiting to happen if we don't get lots more regular drivers. And we are seeing another crisis, which is really in mental health and dementia, particularly with carers who are struggling and have been struggling for a long time, and there seems to be a lack of support, and a lot of people are coming to us and really, you know, we always have a chat with people on the phone, we always refer people on, so we're doing a lot of signposting at the moment, but it takes up a lot of our time just talking to those people about their needs at the moment, and it's pretty awful. It's hard work. My colleague is really worn out and needs a holiday, and she's done some fantastic work with people on the phone, and she's kind of looked after people that have not been able to go out throughout. So, but luckily we've been able to start meeting with those people who are very lonely and isolated, who are, you know, passengers of ours. And so we've started meeting. We do a cuppa and chat session every month, and we've just started, that's opened up again. We've just started running that, and that's been very popular. That's about it really, but I can put my details in the chat, and then anyone can email us or look at our website.
Perfect. Thank you, Sarah.
Thank
And
you.
what we'll do after the meeting, we'll make sure that we share the chat file with you, so you've got all of the details emailed to you. So if you do miss anything as we go along, we've got a bit of a backup there. Okay. Moving on, can I ask Richard from Summer Valley FM to speak next, please?
Thank you very much, Mark, and thank you very much for the invite. I'm a newbie today, so appreciate meeting everybody online. We are based in Midsummer Norton, Summer Valley FM. We cover the majority of North East Somerset in terms of our transmitter, or FM transmitter. We have DAB across Bristol to about 200,000 reach. You can get us online, or indeed ask your smart speaker to listen to Summer Valley FM, and you can listen to us. We have about 70 volunteers here. We broadcast about 14 live or fresh hours a day. And my role as station manager is twofold. One, I have to generate the revenue to support us running as a radio station. And that comes pretty much 50-50 between advertising and grant funding. And secondly, I have a community duty, and not a duty really, so much as a desire to help publicise what's going on. So for instance, I've interviewed people from Dorothy House. We've had the Prince's Trust in on the horticultural, and they've done our garden. There's a press release about that this week. Curo are one of our sponsors, and I interview Victor Takuna, who's the chief executive, or one of his colleagues once a month, as well as running public service messages for them. I manage the Bath and North East Somerset account for their public service messages. So the latest COVID announcement I share with every radio station across the Baines Authority. I've interviewed Swan Transport as well. So that's the sort of thing we do. So one, I'm kind of here to see if I can pick up some tips and ideas about grant and bid funding, because I'm not very good at it and I need to be better at it. But secondly, particularly if it's pertinent to the Midsummer Norton, Timsbury, Polton, Radstock area, if you do need some help, free of charge, we'll put it on the radio. I'll do an interview, we'll put it on the radio, we'll help publicise whatever requirements you have. And that's Summer Valley FM.
Thanks, Richard, and you're more than welcome in joining us today. Thank you.
Thank you.
Hi there. I know Gwen needs to leave at 1, so I'll bring Gwen on next, please. Gwen Edwards. Yeah.
Thank you. And it's the first time I've been on this call as well, so thank you for inviting me. I'm here today with my Chair of Trustees at Keynsham Food Bank hat on. And really just to highlight that our contact details have changed. So if your organisation has had any interaction with Keynsham Food Bank in the past, I'm just flagging up that our email address and the mobile phone number for professionals has changed. The information is correct on the website and Facebook, and we're in the process of sorting it out with Google as well. I've just put the details in the chat there. So we're very much business as usual, delivering to clients. But yeah, just please make a note that the email address, phone number and official postal address, should you wish to send us lovely gifts or cheques, it has changed and the details are accurate on the website.
Thank you, Gwen. That's lovely. Thank you. Okay, is Janet Homewood with us, please?
Yep, just got unmuted, sorry. Yes, so I haven't got an awful lot to offer, I'm afraid. What I do, I work for Salvation Army and we have a safe house for survivors of human trafficking. So we don't give our location out, but what we do is take those survivors in, we offer them support until they are able to move on in whichever direction they decide to move to. So that's me, short and sweet.
That's lovely. Thank you. Always good to just get those short updates as well as the longer ones. It's always good to hear from you. Thank you. Frank Thompson, do you have anything to report back at all, please? Not sure if Frank's with us at the moment or not. I can see him on the screen, but I'm not sure if he's... We'll come back to Frank in a minute. What about Cathryn Bartrum?
Hello, yes, I'm here.
Hi, Cathryn.
Let's put my video on so that you can see me. So I'm volunteer coordinator from the SEND Partnership Service. We're the service for supporting families. There's a SENDIAS nationally across in each authority, and that we're one of them. That stands for Special Education Needs and Disabilities Information, Advice and Support Service. So we support families where their children might be having difficulties with their education. We also support professionals, not on a case-by-case basis, but giving them information and advice, but basically around the law and what provision there should be for those children's education. We've just recruited a new youth engagement officer who is working in the communities to encourage young people to sort of get involved with us, to spread the word as to who we are, what we do, and also to sort of help us get our website right for those young people so that it actually is what they want to be looking at, alongside all sort of social media interactions. I'll put our website on the chat for you. We're also got Parent Champions is a string of our bow where they go out into the communities and again just spread the word and do a bit of signposting. So it's really key for me to be here because we often talk about other services that are in the area that can support those families as well. So feel free to sort of share with me flyers or events that you're doing that you think a Parent Champion might be useful to come to, or anything else. That would be great. Thank you very much, Mark.
Thanks, Cathryn. Okay, moving on. Is Victoria Wells with us?
Hello.
Hello, Victoria.
Thanks for inviting me along. I am currently chairing Grow Bath Eastern. It's a group of residents who set up as a result in the pandemic last year. And it was initially to do with strengthening community, creating food security and encouraging biodiversity. But a year on, everything's folded out and we've set up various clubs. So we're run by volunteers for Bath Eastern, because we've identified that there is a real lack of engagement over this side of Bath. And this Bath Eastern doesn't tend to get all the wonderful services that you're offering. So I think it's something that we're just about to move into charity. Stone & King approached us and said, hey, you're doing charity work. You need to be a charity. We're going to be putting out an advert for an administrator and a community connector. But what's exciting is that we've set up various clubs and these have been really popular. So it's totally inclusive. And from Bee Club to Growers Club, we've done plant swaps and things like that. And so we are really about building community. Obviously, our core principle is about the environment, but we're looking at the psychology behind that and how important we need to be connected with our neighbours and our nearest community. So that's really, do look at our website. We're quite new in respect, but it looks like that we are branching out into areas that you're all doing, and it'd be great to be able to post people on. We've worked a bit with Curo because we planted a load of who have been brilliant. They've allowed us to plant some trees on the Elmhurst estate. I don't actually live there, but it's really engaged the community. We're just doing football club at the moment. We're doing walking football with Bath FC. And as I said, we're doing the Growers Club, but what it has done is encourage people who would not normally want to come forward into a group. But it's, as I said, it's a mixture of people, and it just creates a normal sort of environment for everyone to be integrated in rather than just focusing on. But as a result, we have actually set up a wellbeing group, which every month we like to highlight something. So if anyone's got any think they would like to offer on the wellbeing group, then we'd be really happy to host that, because I know that there will be members of our community that would probably be attracted to anything you'd like to offer. Anyway, that's me. So thank you. I'm finding this absolutely fascinating.
Thank you, Victoria. I think it's really interesting what you say about engagement on that side of Bath, because over recent months, the Connecting Community forums that we run have not been able to sort of be out there doing a lot of that connecting work because we've been tied up with the pandemic. But this month we are bringing those forums back, and what I would ask is, it would be really great to have you on the mailing list for the Bath Avon Forum, because the work that you're doing fits in perfectly with the agenda that they're working with. So I could send you some details after the meeting if that would be.
That would be fantastic, Mark. And if Ali is currently, she does all the administration, so I'll pop the email address in. But yes, we definitely would be interested. Or if anyone else thinks that, we like to get involved in this, we are a community-led organisation for the community. That's our sort of thing. But obviously, we're working with various different partners. So thank you.
Lovely, great. I'll hopefully see you in the future. Thank you. Brilliant. Okay, is Kaylee Deacon Church with us, please? No. Hello, Kaylee. Maybe Kaylee's not with us at the moment. Okay, what about Letitia McCall? No. Okay. Let's see here. So, I've got Gillian Corke. Is Gillian with us?
Yes.
Hello.
Hello.
Okay, great. Thank you. Hello.
Hi, nice to meet you. Thank you. I was invited on the call by Andrea at Future Bright, who I've been working with and with Cool Ventures as well over the last few months, just growing and bringing my business to Bath. I am a positive discipline educator, which, if we're talking in professional terms, is trauma-informed social and emotional learning. And it's an education programme for parents, and I'm also piloting the material for youth sports coaches. When people say, oh yes, we've got a parenting course, or oh, our coaches know what to do, this material is for the spaces in between. It's for the spaces in between. What do I do when I don't know what to do? Or what do I do when the lesson plan's not going quite right, or I've run out of my skill set? We use language tools, we use role play. It's very experiential in the learning, which means that when people do it, they're drawing from themselves and realizing themselves what's going on, and then we give them tools for what to do instead. Just as an example of how effective this training is, one particular city in America used this with a female prison service. They saw reoffending drop from 60% to 30% with a one-year program. And recently a school who'd only been using positive discipline for one term saw referrals to the head drop from 900 to about 300. And you can imagine, for those of you who are working with people with adverse childhood experiences or other mental and emotional needs, the different lens to look through what we're seeing, behaviour as communication, rather than something that needs to be dealt with and moved away, it really changes the life experience for these young people. So I can do anything from a 2-hour introductory workshop to a 6-week course, 1-day in-person training. I can go into trauma and attachment and how to work with people in that way. I can do really gentle introduction to how to ask instead of tell, and how to be kind and firm at the same time. And it's particularly relevant. I've heard a lot of people working with volunteers. We get a lot of people with good hearts who want to do the right thing, and sometimes they're left feeling a little unskilled for what they're being asked to do. So this is a really gentle and inclusive way of giving them some of those tools. I put my email address in the chat earlier, but I'll do that again, and my website, and I'd love to work with anyone in this group around that. Thank you.
Thank you so much. Okay, I've got a few names left on my list. I'll come back round again to see if anyone's wishes to speak. I've got Wendy Loads. Are you with us, Wendy?
Yes, I am. Hi. Hello.
Hi.
Thanks ever so much, Mark. Yeah, just to quickly remind everybody that we're still here. The England illegal money lending team out there to combat loan sharks. We are getting busier. Obviously, the pandemic is actually pushing people towards illegal lenders. There was a report out that 21.7 million people are now unable to make ends meet, and we're very, very concerned that those people might be pushed towards illegal lenders. And what with the Provident now no longer lending as well. You know, I say we are getting busier. Bath and North East Somerset, we're getting a few more calls from that area now. So just to remind people, we have a hotline number, which is 0300 555 2222, man 24 hours a day, every single day. And also I can do some training for people. So if you're interested, I put my email address in the chat, and please drop me an email. Thanks ever so much. Thank you.
Hi, thank you for inviting me. This is also my first time to a meeting like this. I'm Siobhan. I'm a care coordinator for Hope House Surgery and Hillcrest Surgery. We have been newly appointed since May of this year in the Baines area. We're part of the Three Valleys PCN. So myself, Kaylee, Letitia, Victoria and Tom are all based locally. So we are here to help patients with anything that's non-medical, to enable them to take greater care of their own health and well-being, and support them to make decisions about their care, and work with them to establish any support or help that they may need. We're available to provide that short-term or long-term, whatever the patient may need in time. I have been, as Tom said, I've been doing a great piece of work with Tom Fox from the Carers Centre, currently going through the carers lists, finding out who is still a carer, and then giving them the support they need if they don't already have it, in particular referring them to the Carers Centre, where they do get invaluable help and support. So we're mainly signposting. So that's why we've come along to this meeting today, is to find out what is out there and available for people service-wise, so that we can then signpost out appropriately. So if any of you guys feel that you've got a service to offer us as care coordinators to offer out to our patients, if you could let us know, that would be fantastic. I'll pop my email address in the chat, and the other care coordinators will probably do that as well, I'm sure. So that's it.
Thank you, Siobhan. That's great. Thank you very much. I've got two names on my list that I haven't heard back from yet. Is Frank Thompson? Are you wanting to speak at all, Frank? No, not hearing from Frank at the moment. And Kaylee Deacon Church. Oh, she's given her apologies, evidently. I've just been told. Okay. Is there anyone left on the call that has that hasn't had a chance to speak, that would like to speak at all?
Could I jump in very quickly, Mark?
And yes.
Thank you. So I'm Rebecca Hare. I am the Heritage Marketing Manager, and I work in Heritage Services at Baines, very closely with Rosemary on the Fashion Museum. And I just kind of wanted to expand a little bit on what Rosemary was saying at the beginning of the call, because as well as this very exciting new exhibition we're going to be having in 2022, there is a wider piece of work that we are working on in Heritage Services, which is all about community engagement with the Fashion Museum, within the Fashion Museum, and how the Fashion Museum can connect and inspire and engage a wider range of audiences, both within Baines and the wider area. The first part of this is that we are looking to do a little bit of a research project to see firstly who isn't coming to the museum, and then kind of delving a little bit deeper and trying to understand why they aren't coming to the museum. What are the current perceptions of the museum? What are the barriers to entry, and how we can kind of break down those barriers and encourage as many people to come and experience the wonderful collections that the museum has to offer. So there was a survey that went out a few weeks ago that the community engagement team very kindly shared with us, shared with you. We're going to be opening that survey again for a little bit longer, and we are also hoping to run some focus groups in September to discuss this a little bit further. So if anyone would like to be involved, please do get in touch with me or with Rosemary. We would absolutely love to hear from you and hear your insights into how we can make the Fashion Museum a really exciting and positive space for everybody. I think that was under 2 minutes, Mark.
That's fine. That's fine. We're doing very well for time. Brilliant. I think I've been around the screen and give everybody an opportunity to speak. We have got a little bit of time if anyone's got any further questions or comments that they would like to add. Otherwise, I think we're pretty much done for today. And thank you.
Could I ask one question, Mark, if you don't mind? And forgive me, I don't want to hold everybody up. But why do you run this, Mark? What's the aim for you?
Well, it's really important that as an engagement team that we know what's happening across Bath and North East Somerset, not just for us, but doing it in this format is really good because we get a lot of people that can hear about things that perhaps they wouldn't if they weren't coming to these meetings. And before COVID struck, we used to hold them regionally. We used to hold them in Bath, in the Chew Valley and in the Somer Valley, and they were held, and it brought together people. We all would sit around and share things face to face. Doing them as one big meeting now, I think people are finding that they're getting a lot more out of the meetings and they're hearing right across the district rather than just in their own geographical areas. But for us, it's very important that we, because Alison is constantly typing away next to me, report to make sure that we're actually collecting all the information in. And we will also put this meeting out on YouTube, so people who haven't been able to make the meeting can access it as well. And it also, if there are things like funding opportunities that come up, we do a funding bulletin, and we can add information to that. And we also have our interagency bulletin as well. And it is also a feeder as well, because if there's somebody with something that they feel passionately about that they would like to come and present on more, there's an opportunity to bring ideas into the area forums, which I mentioned earlier, that are coming back now. So it really is an integral part of the engagement process that we go through at council.
Thank you.
Is that okay? Anything from anyone else today at all? Great. Well, we've all got a little bit of an early getaway from this meeting. I think next time I'll give everyone 3 minutes rather than 2, because hopefully nobody did feel too rushed. I know some people have very little to say, some people have an awful lot to say. So if we ever do put a time restraint on you, please let us know if you do need a little bit more time at the meetings, because we don't want anyone feeling that they are rushed or being moved along too quickly. But from Alison and I, thank you very much again for attending, and we'll send all of the information around to everybody and also the date for the next meeting. We hope to see you all soon.